Hi, my name is Alyssa Sullivan, and this is my capstone presentation. So, what are opioids? Opioids are drugs that act on receptors in the brain that regulate pain and emotion. Um, there are two different kind of groups of narcotics that include prescription medication, which are the oxycodones, hydrocodones, and morphine. And then we have the illegal drugs that are heroin and fentanyl. So it came in three basic waves when the crisis started. The opioid crisis was not just a problem that had been focused in Nebraska, but it was a problem that was nationwide, and it occurred in these three different waves. With the first wave that occurred in the 1990s, it started with the opioids being prescribed to patients with pain. By 1999, they started to see an increase in overdose deaths with increase from prescription opioids. In the second wave that started in 2010, it was the dealing of heroin, and in the final wave occurring in 2013, overdoses and deaths had increased due to the accessibility of synthetic opioids involving fentanyl. In 2017, DHHS noted that Nebraska doctors were writing prescription opioid medications to patients 56.6 to every 100 that were being seen. So there are some resources that are available when it comes to opioid crisis. There was Project Echo, is an extension for the community healthcare outcomes, and they work with prescribers across the state, help educating them on addiction and pain management, expanding treatments to rural areas of the state. There is also Stop Overdose Nebraska. They're a organization that works in providing education specifically related to Narcan. There is no cost to getting Narcan, and it is accessible in stores without a prescription if you feel you or a loved one may be struggling. Their purpose is to help bring awareness about opioid crisis and prevent overdose from happening. And one of the last resources that I had found was Nebraska Meds Coalition. They're also a group working to educate patients about the safe disposal of prescriptions and over-the-counter medications. Some of their goals are to decrease pharmaceutical waste, prevent harm to the environment, and protect water quality and avert accidental ingestion. So why I chose this topic? I chose this topic because I work in a substance abuse facility currently. I've seen what being addicted to opioids and other substances can do to somebody's life. Working in a substance abuse facility, I have heard the different stories. I've seen the struggles from how a person can become addicted and how easy it was for them to get that substance. To seeing how they can relapse when they've left treatment and needing to come back again. When it comes to the opioid crisis in Nebraska, we have seen the rise of fentanyl. In a press release from UNMC, Dr. Tina had discussed how this was a big problem we are facing, where the drug is being mixed with oxycodone and other black market drugs on the street. They are finding that dealers are selling these drugs to people and that they are causing the overdose rates to rise among individuals. If we don't start taking the charge now on trying to get these drugs off the streets or finding different ways or programs to educate people and prevent them from being sold, we're only going to continue to see the climb in overdoses and addiction among individuals. So for me, I've always had a passion when it comes to mental health and people who are struggling with substance abuse. Most people who struggle with mental health issues usually tend to take some type of substance for a way of coping. They feel that it's their only option that they may have. Most people usually tend to not be able to afford their mental health medications. They simply stop taking them because they start feeling better. So working with my patients, it is a complete non-judgmental zone. They usually feel safe telling us, what they're taking, how much they use when it comes to different substances. We're here to listen to them, help them come up with different coping skills, as well as educate them on taking their medications. We provide groups and ways to help process their traumas and help them to recover safely. So in my first experience being an effective communicator, I have been working at my current job as a nurse in a mental health substance abuse facility. I had the opportunity of working with an 18-year-old youth. He was facing his first DUI, jail time, and had difficulty dealing with his family dynamics and was unsure of how he was going to navigate these new challenges. In our treatment facility, we offer a 30-day treatment where patients participate in groups. He did not want to participate or want any interaction with his peers. He felt he had let his family, his friends, and others around him down and was starting to battle the flight response, wanting to run. So in learning about being an effective communicator and working with this youth, he was feeling like he was abandoned, allowing for him to feel that he couldn't share any of his fears, his problems, or wanting to share any celebrations that he was making in any of his time here. I was able to make myself available to the family of the youth for questions that they had. If there were any changes in medication, I made sure they were notified. I also made myself available to the youth, making sure that he knew he was able to come and talk to me, share what was going on, if he needed to talk, share his fears, share his celebrations that he did have, his progress, any stories that he wanted to talk about. So it was a different role, changing from a floor nurse working on a medical floor to coming into a mental health floor, changing the way you communicate and the way you do your assessments. The focus is more based on how one is feeling and what their struggles are in that moment or that day. How I related this with my public issue with the opioid crisis, I found that communication is an important piece of the puzzle. How a person receives it, as well as how people want to be heard. How I have addressed the opioid crisis, and through my research, I have found that by us being able to help communities understand substance abuse disorder is a disease, that it is not something that shows a person failing or bad character. We need to be able to communicate with individuals that there are programs out there to help them with their addictions, as well. If they feel they are in need, they can get access to naloxone. We need to work by reducing the stigma towards substance abuse and look at ways to speak out and speak up for those who are struggling with opioids. In my second experience of being an effective communicator for Reflection 2, I had to work through developing skills and working through my anxiety and feeling a lack of confidence. In my last year, I had gone from being a CNA of 12 years to changing my role into a nurse. I felt that I was comfortable when it came to being able to build rapport and communicate with my patients, but when it comes to the knowledge and learning of different ways to communicate, that made me feel more nervous. I had to adapt my skills and build a confidence, trust in myself that I knew what I was doing, and that I had learned my new skills in school. I was able to find ways in educating my patients, talking and feeling comfortable when it comes to providers and other members of the interdisciplinary team, and continuing to improve on my assessment skills. What I learned from having this experience about being an effective communicator is the importance in building confidence with verbal communication when working with patients, but also with physicians and other members of the team. How I present myself in a patient's room does matter. If I don't look them in the eye or face when asking questions, that may come off like I didn't care. I also found that getting down to their level was important in many of my interactions. As a nurse, how we communicate is going to be different in each interaction that we have. It can make or break what type of relationship you build with them. How being an effective communicator relates to my public issue, because verbal as well as nonverbal communication are important factors when addressing the opioid crisis. When you have a patient come and get admitted for treatment or seeking help with what they are struggling with, you can see that they are battling demons. They are feeling different emotions about being judged, feeling as if they have failed or just can't try and do this again. It is important that being a nurse in the healthcare setting, we find a way to recognize these situations and make ourselves open to each person that comes in. finding the right words when talking to our patients so they do not feel we are stigmatizing them, asking open-ended questions, and providing a safe place to listen to their story. For my first reflective communicator, Reflection 1, while I was in nursing school, we needed to get so many volunteer hours, I struggled with what I would do. I could not decide where I wanted to go and get my hours. I am not the most outgoing person and do not like to put myself in situations I feel like are awkward. I had done research on places where I could go in Lincoln and found the sister company that works with People's City Mission called the Help Center. At the Help Center, I worked on taking donations that come in from donation bins, people that bring things in, or items that are donated from local stores or churches. In the back of the center is where everything is brought in and sorted to see what can be put up in front of the store for people to shop and take home. Some of the belongings are clothing, food, home goods, bedding, books, and furniture. What I learned from this experience was the different cultures that are residing here in Lincoln, as well as the different people that are in the community who are in true need. I was able to have the experience to sit down and talk with people who came from different situations than my own. I was able to step away from my own bias or assumptions, take the time to get to know the people coming in, and hear their stories. Having my patients that I work with, they come from different types of situations, dealing with substance abuse, mental health conditions, and trauma PTSD. As a nurse, I know I have the responsibility to care for them in a non-judgmental manner, gather information, and have an understanding as to do what they may be going through. When it comes to the opioid crisis, we need to think about why individuals have started using. What was their trigger? Did they have a prescription from a doctor and then have other physicians continue to refill that medication? I think it is important that being a reflective individual, we take care of each patient as they are, like any other patient, caring for them as a whole. For my reflective communicator, Reflection 2, this last year I had the opportunity in our Nurse 436 to rework my nursing philosophy. It was also an assignment that I had to work on while working on my associates. But having to work on this again and think about how I want to grow as a nurse and how I saw things changing while being in this program made me do a lot of rethinking of how I viewed myself. A nursing philosophy is not just a guide, but it is there to help us with our actions, providing us with a guide on interactions, decisions, giving us a self-understanding. When adapting my nursing philosophy, I knew that I needed to work on my communication skills and how I could better improve my verbal as well as nonverbal skills. What I learned through this assignment was to understand the importance of what I want and the type of person that I want to be for my patients. I realized that when working on my personal philosophy, I have changed a lot from being before to being a nurse and to how I see myself now. I have found that when I work with my patients, I have a lot more confidence in what I am doing. I am more comfortable when communicating, but as well when using my skill sets that what I learned, I am able to sit down and personalize care plans to their specific needs as well as educate them on different topics that pertain to their health needs. For example, we had recently admitted a diabetic who was diagnosed just recently. We were able to educate him on being able to form his own blood sugars and give himself insulin so that when he leaves the treatment program, he will be able to do this all on his own at his home. Having my own philosophy is important when it comes to working with patients struggling with substance abuse. It helps provide a framework and navigate challenges that we may not be comfortable with. It offers us a guidance to being empathetic and providing patients with the best care that we can. Having a framework of how I want to be as a nurse has provided me with the balance with creating better nurse-patient relationships and providing non-biased treatments. If we can build a philosophy that is non-judgmental and compassionate, it can help to combat stigma towards substance abuse, ensuring that they feel respected. For my change agent, Reflection 1, my experience that was important to me was my first CNA job that was in a nursing home in Seward. I had been working there for over a year and had come to know my residents very well along with their families. We had 2 different companies that would come out to the home that were hospice-based so that residents could stay in their home and pass in comfort. I had a resident that I had become very close with. She had Alzheimer's, Parkinson's. She was on hospice and was close to her time of passing. She had a family that had driven and flown out to be at her side. On this day, I was not working but lived close by. And in a small town of Seward, everyone knows everyone. She had passed away, the hospice team had not arrived in time, and family requested to see if I could be called in. They reached me and I did come in. I sat with them, spent time hearing their stories and telling my own. In this experience, I learned a lot about myself at that moment. I don't know why I felt that it was my place to come in and get involved. Things would have been taken care of and they would have been fine. But for me, I knew that if it had been my family, grandparents had passed, and I was close to that person who took care of them, I would want them there. Someone that had built a connection, sitting and telling stories, or just even hearing stories about my loved one. Being a change agent regarding the opioid crisis includes applying leadership, collaboration, and driving meaning improvements in healthcare. We are going to be dealing with individuals who are battling substance abuse in multiple settings. By being open and non-judgmental to the situation they may be in, we are able to collect information about what is going on and find the best way to treat them. By examining and looking at what the possible root cause is, overprescribing, lack of mental health support, economic hardships, and stigma. For my second change agent reflection, at the start of July 2024, I had accepted a position working in Omaha as a nurse on a med-surg floor. This was the first nursing position that I had been hired for. I had my main orientation days at the hospital, but I was going to be working my first shift on the floor. When I got to the floor, I was told who my preceptor was going to be, and then I was given 3 patients on my own right off the bat. Mentioning to the staff this was my first shift as a new nurse, I was not yet comfortable with things, as I had not worked with their EMR system or used their IV pumps. It was not long after that my preceptor had disappeared. She was not happy about being one and did not want to have to work with a new nurse. I made it 2 weeks into my orientation, looking for things to improve to see if I would get some extra help or a new preceptor. Things did not improve, my confidence was gone, and felt very unsure of myself. What I had learned from this experience was that having this happen made me a better nurse. I had to jump into a situation that I was not prepared for and did not feel comfortable in. It hurt my confidence as a nurse, but it also made me realize that situations like this can occur and I need to be ready. I realized I don't have to be perfect. It's okay to ask questions. I should not feel embarrassed or that I am bothering someone. I would have handled this situation differently looking back on things now. Instead of shying away, I would have approached things immediately, sought help right away, and spoke up for myself, saying this is not right. As a change agent, it shows how we can help to drive improvements in care and treatment for patients. How this has helped me to bring insight, it has shown the importance of fostering culture that is positive and drives improvements in the way we give patient care. For example, as a change agent, we work to encourage collaboration among healthcare professionals. We need to make sure that we are all on the same page when providing culture of learning. We are helping each person who is providing care with a new way of providing education about substance abuse, as well as providing proper patient care when one is withdrawing. So in conclusion, within the state of Nebraska, we need to find better ways to improve upon substance abuse. The crisis is a nationwide problem that started in 3 waves, with the last wave being due to the increase of fentanyl overdoses. People are continually using these types of substances to deal with their mental health needs, finding ways to drown out the noise they are battling in their heads, to deal with anxiety, isolation, fears that stirred after COVID-19, poverty, stress, and boredom. As an effective communicator, I hope that I will be able to approach each patient that I work with on an individual matter in a non-biased, non-judgmental way, so I can find what is the best way I can help them. As a reflective individual, I will understand that each person comes with their own story. They are dealing with mental health struggles, addiction, stigma, and trauma. I will reflect on my own experiences and provide empathetic understanding and care to each person. Lastly, as a change agent, I want to find ways in which I can promote and find new ways in which help people who are struggling. By volunteering and working with the public health department to find better approaches to care for individuals who are struggling with addiction. Thank you.